Well, there are now 15 coronavirus cases in the U.S., and that's according to the CDC.
The new patient is an evacuee from China who had been under quarantine at an airbase in San Antonio, Texas. Public health officials say the person is in stable condition. Hundreds of American evacuees, including State Department employees and their families, are staying at military bases in Texas, California, and Nebraska.
So far, there are nearly 65,000 cases of coronavirus worldwide. Close to 1,500 people have now died.
Our chief health editor, Dr. Parthananda, joins us now with a closer look at the new case of coronavirus in Texas. Doc?
So, David and Glenda, not too many details have been released just yet, but here's what we do know. This American was evacuated from Wuhan, China, the epicenter of the outbreak. They were one of 91 evacuees who were taken to the JBSA Lackland military base in San Antonio and placed under a 14-day quarantine that began February 7th. Now, about 4 days later, this person developed a fever, so samples were taken, and shortly thereafter, the CDC did indeed confirm a positive diagnosis for the COVID-19. Now, the patient was reportedly traveling alone, but has been keeping in touch with family members here in the U.S. by phone.
So, Dr. Nandi, what do we know about those other quarantine cases in California?
So, Glenda, these two folks that were quarantined at the Marine Corps Air Station Miramar in San Diego ended up also testing positive for the COVID-19. They're both in isolation, and they were on the same flight along with 193 other Americans that were evacuated from Wuhan. Now, there may be a third case as another person has developed symptoms. We're just waiting on the test results. But it won't surprise me, Glenda and Dave, if more folks end up sick, as there are over 600 evacuees still in federal quarantine that are being monitored for this very contagious virus.
Wow. Have any of these cases, Doc, in the U.S. been considered severe?
So, Dave, it appears that the majority of patients diagnosed are reportedly doing well, so that's good news. However, not every case is regularly updated, and some don't share many details due to privacy reasons. But just like other viruses, some people are more vulnerable than others, right? So with this respiratory illness, it tends to affect on average older folks, although we do know that younger people have also died. But the good news is that the CDC still maintains the risk for Americans as low, despite the fact that we're likely to see more cases here in the near future. So stay tuned. I've been keeping you updated with the coronavirus, so we'll keep doing that. Anything comes up, we'll let you know right away.
For sure, Dr. Nandi. We thank you so much. And if you have a question or health concern for the good doctor, you can email him at drnandi@askdrnandi.com or send it to us on Facebook or Twitter, and we'll get it right to him.